Well, first of all, thanks for having me. I think what we would best describe it as is organized chaos. Well, we're lucky being an HCA system that in terms of PPE and supplies, we're doing great. But as you understand, with over 200 medical personnel being in our hospitals and the fact that those numbers are going up so rapidly, it's really concerning what the next 4 to 6 weeks really have in play.
Hey, are you getting the support you need? Or is the personnel coming in? Do you have the equipment you need?
Oh, definitely. So again, as part of the HCA network, we have a huge supply chain. And so we're not worried in terms of supplies, equipment, the things we need. We're bringing in physicians, nurses specifically. Those are the real people that are driving the care that we're able to give in the hospital.
Doctor, do you have a sense for why this is happening and why now? Is there something specific to your community, or do you know?
We're not really sure. So if we look at the city numbers, part of it is gatherings, a lot of family gatherings. We're a very family-oriented city, multi-generational homes where children, an adult, and even a grandparent live in the same home. I think 79938, which is one of our zip codes, is actually one of the most populated zip codes in America. And you have to remember that we are on the border. Juarez just closed down their city over the weekend, and they're going to go into a 14-day shutdown. So multifactorial, we can't really pinpoint it, but I think the important thing is for people to understand that irrespective of the numbers, they're human beings. Those are lives. And so we kind of get lost in the 1,000 cases, 10,000 cases. But that's the 20-year-old that got intubated in our ICU, or a patient that came in the other day in their 50s was asking for a cup of Sprite prior to getting intubated. That may be his last wish. And so people have to remember those numbers are just numbers. It's a human tragedy, and we need to work together as a community to improve it.
Dr. Alozi, before we go, I know as medical professionals you have to plan ahead. As you plan ahead for the next 2, 3, 4 weeks, what are you seeing?
I think that the community and the country needs to realize that this is just the beginning of what could be a dark and tragic time over the next 4 to 6 weeks. We understand that cases beget hospitalizations, which beget tragically deaths. And so as we're working with our city authorities, our community, and the hospital partners, as well as FEMA and the governor, we're really focused on getting the supplies we need to keep as many people safe and alive as possible.
I bet you're begging people to follow the Fauci and wear the masks.
Oh, totally, totally. I mean, I think we should be way past the conversation of mask, physical distance, stay at home. But again, anytime that we can reiterate it, I think it's critically important.
Follow the Fauci. Dr. Ogachika Alozi, it's great of you. Thank you. Shepard Smith here. Thanks for watching CNBC on YouTube.